Hi everyone, today's topic is hypothyroid disorder. If you have any questions or if you want to make an appointment, please call us at 919-869-6661 or you can visit us at www.ciclinic.com. In this presentation, we will discuss the integrative diagnosis and treatment of hypothyroidism. We will point to different types of hypothyroidism, including subclinical and sublaboratory hypothyroidism, and also discuss the important diagnostic tests to consider, common pitfalls in the diagnosis and treatment of thyroid diseases, diet, nutrition, and supplements, and best medication options will be reviewed. Let's quickly review the anatomy of the thyroid system. The anatomy of the thyroid system starts with two master glands, hypothalamus and pituitary gland. Thyrotropin-releasing hormone, or TRH, is released first, which initiates the release of thyroid-stimulating hormone, or TSH. TSH then induces the thyroid gland to produce its thyroid hormones, mainly T3 and T4. So one can define hypothyroidism as a process where the thyroid gland produces too little of its main hormones, T3 and T4. I should mention here that there are other hormones that are produced by the thyroid, T0, T1, T2. We are not sure at this point about the significance of these hormones on the body. When these hormones are produced, they influence every cell in the body, and their main function is regulating body's metabolism, growth, development, temperature, and catecholamine levels, as well as influencing heart rate, amongst other things. Let's quickly review some of the interesting facts about thyroid function and hypothyroidism. The highest levels of TSH secretions are between 10 p.m. and 4 a.m., and the lowest between 10 a.m. and 6 p.m. Therefore, the thyroid hormones, T3 and T4 mainly, reach their peak early in the morning. T3 is the more active of the thyroid hormones. Of the thyroid hormones, T4 constitutes roughly 80 to 90% of the hormones produced by the thyroid gland, and T3 between 10 to 20%, more or less. Most of the circulating T3 is derived from conversion of T4 to T3 in the peripheral tissues. T3 sends negative feedback to the pituitary to reduce TSH secretion. 1 microgram of T3 is equivalent to 4 microgram of levothyroxine, or T4. Therefore, the use of T4 only preparations, which are levothyroxine, Levoxil, or Synthroid, might alter the normal ratio of T4 to T3 in the body. Studies suggest that each individual has a unique set point of thyroid hormone levels, and that deviation from the set point may not be desirable. Hypothyroidism tends to run in families and more common in women than men. Let's quickly review different types of hypothyroidism. Primary hypothyroidism refers to the thyroid gland's inability to produce enough thyroid hormones. Secondary hypothyroidism refers to one of the master gland's pituitary dysfunction, and it's usually caused by diseases such as pituitary adenomas, which causes reduction of TSH, and that causes ensuing hypothyroidism. Tertiary hypothyroidism refers to another master gland's dysfunction, hypothalamus, caused by diseases such as sarcoidosis or infections. That causes reduced production of TRH and therefore ensuing hypothyroidism. There are also other lesser known types of hypothyroidism, which I will not get into the details of them, including transient hypothyroidism, thyroid hormone resistance, and euthyroid sick syndrome. There are other less known types of hypothyroidism that are important to consider. Subclinical hypothyroidism refers to patients with elevated TSH but normal T4 and T3. It is estimated that 8% of women and 3% of men suffer from this condition, and the rates increase to 15 to 18% in women over 60. Sublaboratory hypothyroidism refers to a syndrome of clinical hypothyroidism with normal laboratory tests. In such patients, the standard thyroid tests fail to detect hypothyroidism, but the symptoms are there, and treatment with thyroid hormones improves their symptoms. If such a patient is diagnosed, they are urged to try to wean themselves off of the thyroid hormones after being on the thyroid medicine for about 18 months, because in half to 2/3 of these patients, symptoms do not return when the treatment is stopped. The signs and symptoms of hypothyroidism can vary a lot. Some of the general miscellaneous sets of symptoms can range from general appearance of pallor, dry, coarse skin, especially in the lower legs, asthma, carpal tunnel syndrome, cold extremities, intolerance to cold, constipation, decreased libido, edema, which is swelling of the extremities, as well as erectile dysfunction. Other common general signs and symptoms may include fatigue, headaches, muscle aches, reactive hypoglycemia, that is hypoglycemia after eating, recurrent infections, sluggishness, weakness, and weight gain. There are specific signs and symptoms that refer to gynecological set of symptoms seen in women. They can range from fibrocystic breast changes, infertility, menstrual irregularities, polycystic ovary syndrome, postpartum depression, and PMS type syndromes. Some of the ear, nose, throat specific signs and symptoms may include what seems to be allergic rhinitis, hoarseness, tinnitus, which is ringing in the ears, vasomotor rhinitis, runny nose, vertigo, which is dizziness. Skin-related signs and symptoms may include coarse, dry, or thinning hair, dry, rough skin, psoriasis, and urticaria, which are hives. Cardiovascular sets of signs and symptoms of hypothyroidism may include angina pectoris, chest pains, atherosclerosis, worsening of hypercholesterolemia, elevated homocysteine levels, and high blood pressure. And even if the patient has these symptoms, hypothyroidism can worsen these symptoms. Some of the psychiatric type symptoms that can result from hypothyroidism or can be worsened by it includes depression, memory loss, and poor mental concentration. Let's quickly look at different causes of hypothyroidism. Iodine deficiency is the most common cause worldwide. In the developed countries such as the United States, destruction of the thyroid gland by certain diseases such as Hashimoto's is the leading cause of hypothyroidism. There are also medical treatments such as radiation therapy, surgery, radioactive iodine therapy, and medications such as lithium that can trigger hypothyroidism. Contributing factors to hypothyroidism may include genetic predisposition, gut issues such as leaky gut syndrome, food allergies, stress, toxins in the environment, and other hormonal imbalances, especially estrogen, DHEA, and cortisol imbalances. When one is checking for hypothyroidism, the minimal test, in my opinion, should be TSH, free T3, free T4, reverse T3, as well as antibodies to the thyroid gland, and other tests of the thyroid if necessary. One needs to be vigilant and check for other things such as other hormonal imbalances, nutritional deficiencies, toxins, etc. One also needs to keep in mind the self-laboratory hypothyroidism, which, as you remember, are patients who have hypothyroid symptoms without abnormal laboratory tests. So when checking for hypothyroidism, it is not only important what tests are being run, but is equally important of who is interpreting the tests. If the physician or the provider is not familiar in reading the tests appropriately, hypothyroid disorders might be missed. Let me give you an example. In 2003, the American Association of Clinical Endocrinologists proposed the upper limit of TSH to be changed from 5 to 3, questioning first of all the validity of the TSH test alone as a measure of hypothyroidism, and if their recommendations were to be implemented, 4 times as many people as before will be classified as hypothyroid. In other words, instead of 4.6% of the population, 20% of the population would be diagnosed as hypothyroid. The integrative treatment of hypothyroidism takes a comprehensive approach, uses lifestyle changes such as exercise, yoga, stress reduction techniques. It also encourages patients to avoid medications or toxins that can worsen the symptoms such as lithium, aluminum hydroxide, chlorine, fluoride, etc., as well as the use of topical antiseptics such as betadine, and if possible, avoiding of radiocontrast dyes. The diet in hypothyroidism includes a diet that is an anti-inflammatory and heart healthy. It limits certain vegetables from the brassica family, such as cabbage, turnips. It limits soy, peanuts, and pine nuts. It limits millet, peaches, strawberries, spinach, etc. Vegetables are encouraged to be cooked or steamed and to be eaten at least 2-3 hours separately from the thyroid medication. Calcium carbonate, iron, fiber, and some forms of magnesium, especially magnesium oxide, have been shown to inhibit the absorption of thyroid hormone and therefore should not be taken within 2 to 4 hours of taking the thyroid medicine. There are certain supplements that can be used in the treatment of hypothyroidism, including iodine, iron, selenium, vitamin A, zinc. It is encouraged for these levels to be checked before they are used and to be used under the care of a knowledgeable provider. There are also certain botanicals that can be helpful in the treatment of hypothyroidism. The provider must be knowledgeable about these botanicals and their interactions with any medications. Perhaps the most controversial part of hypothyroid therapy is the use of correct medication. Currently, there are different types of medications available. Synthetic T4 in the form of levothyroxine under brand names such as Synthroid, Lavoxil are most commonly used. There is synthetic T3 available, such as Cytomel brand. There is synthetic T4 and T3 with 4:1 ratio, such as Thyrolar. There's also desiccated porcine in the form of Armour, Nature Throid, etc. that's available. Most patients take their full daily dose of thyroid hormone in the morning. Some may find it useful if they split and take half to 2/3 of the daily dose in the morning and the remainder in the afternoon or evening. This is especially true of patients taking 120 milligram or more, and they are encouraged to consider splitting the dose in order to avoid the possibility of receiving a large amount of T3 at once when they're using desiccated porcine. When treating hypothyroidism, multiple considerations need to be made. For example, a significant minority of patients respond much better to desiccated thyroid than they do to synthetic T4, such as levothyroxine. When using porcine thyroid gland, one needs to know that the concentration of T3 is twice that of in the human thyroid secretions. One needs to know that subclinical hypothyroidism may be a consideration in patients who have muscle pain when they take statins. One needs to know that overtreatment of hypothyroidism may lead to side effects such as osteoporosis, symptoms of anxiety, nervousness, insomnia, etc. Administration of thyroid hormone prior to correcting adrenal insufficiency can trigger an adrenal crisis. DHEA therapy may potentiate the effects of thyroid medicine, and the thyroid medicine may need to be lowered. One needs to know that there are other medical conditions whose symptoms may overlap with the symptoms of hypothyroidism. They include reactive hypoglycemia, food allergies, hypoadrenalism, candida-related complex, iron deficiency, depression, anxiety, etc. Following is a list of 2 key web resources that might help you understand thyroid and thyroid disorders better. I hope you find them useful. I hope you have found this presentation useful. To contact us, please call us at 919-869-6661 or visit us at www.ciclinic.com. Thank you.